I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Dear Lord, I thank you for this day. I thank you for everyone who could be here. Thank you for safety bringing us here. Pray that you would be with Mr. Hankins as he is doing his work as a law enforcement officer. Pray that you would be with all our men and women in uniform, that you would keep them safe. Lord, we thank you for this season. We thank you for sending your son, Jesus, to take away our sins, that he could come and be born. Pray that you would give us wisdom this day. Give us a safe drive home. In Jesus' name, amen. Next up, we have roll call.
Commissioner Turnbull,
Present.
Commissioner Mapes.
Here.
Commissioner Mason.
Here.
Commissioner Rubing,
Here.
Commissioner Chamberlain,
Present.
Commissioner Levanway. Here. Commissioner Hinkins. Commissioner Aaron's.
Here.
Thank you. Do we have anything that needs to be added or removed from the agenda? Okay. Then we will move on to the minutes from November 7th.
I'll make a motion. We approve of the minutes. I'll support.
Melanie, who you got for your second?
You can do Don. Don beat me.
We'll give it to Don.
Oh, you can get Don.
Is it going to be Don then?
Yeah, we'll give it to
Okay.
Don. Any discussion? All those in favor of approving the minutes, say yes.
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 Opposed, no. Motion carries. Public comment. We have some guidelines for public comment in the front of our agenda, but each person who desires to address the Board of Health will be given 3 minutes. Do we have anyone that signed in? Otherwise, we will take, yep, we have a few. Okay, first on our list, I have Elijah Anderson.
Good morning to you all. My name is Elijah Anderson, and I belong to Jesus Christ. Yesterday, I read this report that was sent out about the increase of HIV here in northern Michigan. I found it pretty fascinating and a little disturbing, to be honest. From 14 to 44 cases, that's an increase of 214%. It's a pretty scary statistic. Not specifically because of the amount of people, but because of how serious of an illness it is. But what I found more terrifying was that there was no mention whatsoever of HIV being driven and spread by homosexuality and sodomy. This, despite the fact that according to the CDC, about 70% of new HIV diagnoses come from homosexual encounters. This, despite the fact that whoever wrote this document, beyond a shadow of a doubt, knew that sodomy was a driving factor. They had to write on tiptoe, if you'll excuse the metaphor, in order to avoid the issue. They only obliquely reference sex at all, much less homosexuality. Instead, a large percentage of the document is taking up in the importance of medical tests to make sure someone hasn't caught it. Now, I'm not against tests. I find these tests to be absolutely important, but I find it amazing that not a single word was not spoken talking about abstaining from sin. Proverbs 5 verse 22 says, his own iniquities entrap the wicked man. He is caught in the cords of his sin. Homosexuality is sin. Sodomy is sin. The vast majority of those who get HIV get it because they were committing sodomy with other men. Their sin has ensnared them. The fact of the matter is, if this board pushed instead abstinence, and if people instead abstained from this sin, HIV would be eradicated within a number of merely a generation or so. How do I know this? I lived with a man with HIV for about 5 years. I do not have it because I avoided that sin. This was a good friend of mine. He still is to this day. Until we recognize the fact that sin stains the body as well as the soul, until these people are called to repentance, there will not be a solution to this issue. I'll close with what Ephesians chapter 4 tells us about this. That we are not to walk as the nations in the futility of their mind, having their understanding darkened, being alienated from the life of God because of the ignorance that is in them, because of the blindness that is in their heart, who being past feeling have given themselves over to lewdness, to work all uncleanness with greediness. The health department, in putting out an alert like this, has demonstrated their blindness in avoiding the real issue. We don't first need more testing. We need first to call people to repent and turn to Jesus Christ. Thank you for your time.
Next, we have Terry Jackson.
My name is Terry Jackson, and I'm a recently retired physician. I was trained at the Cleveland Clinic in internal medicine, and I've worked 30 years in northern Michigan in the hospitals, in the clinic, and in nursing facilities. There was a couple of statements made last month in regard to COVID that I'm not sure the origins of it, but it was stated emphatically that COVID cannot be cured and it cannot be prevented. And certainly we know how to treat COVID in the individual. If you mean it can't be cured from the population, there's only one virus I'm aware of that's been eliminated from as a human host, and that's smallpox, which I suppose many of you have a scar on your arm from where you had your smallpox vaccination. But clearly, we can successfully treat COVID and reduce the morbidity and mortality. And secondly, it was stated it cannot be prevented. Well, we can prevent it by isolation and masking techniques. These are science proven modalities that will continue to be important. Perhaps it was thought that with vaccination, the virus still enters your body. Speak this a little louder. Yes. Yeah, thank you. With vaccination, the virus still enters your body, but the effect of the vaccination is you shorten the course of the disease, you shorten the severity of disease, and you can reduce hospitalizations as well as deaths. Now, there is a new vaccine that may prevent the infection from ever entering your body, and it works on the mucosa or the tissues of where the virus actually enters your body. So we know that we can identify the virus, we can successfully treat it, and we have modalities that will continue to be important to prevent its spread with vaccination, masking, and isolation. Thank you for your attention.
Next, I have Mary Lieberman from Emmett County.
Hey, Mary Lieberman, Emmett County. In light of the board's decision to include the invocation again on the agenda and continued storytelling in both public and commissioner comments, I'd like to use my 3 minutes today to read from one of my favorite holiday stories, Emmett Otter's Jug Band Christmas. Christmas was coming, and it was coming fast. It was coming to the town where the houses huddled with their cozy windows shining in the winter dusk. It was coming to the country where the snow lay drifted up against the barns and the firewood was all stacked beside the houses. And it was coming to the river and the little rundown place where Emmett Otter and his mother lived, near Frogtown Hollow. Christmas was coming and money was more scarce than ever. Emmett Otter's father was dead, and his mother took in washing. There was no electricity out in Frogtown Hollow, and Mrs. Otter did her washing with a washboard and a wash tub, all by hand. Emmett rode up and down the river from Turtle Bend to Osprey Point, picking up the laundry that Ma's customers left on their boat landings, and he delivered it when it was done. Emmett hauled the water and he did the chores. He cut the firewood and he stacked it. He went out with a tool chest Pa had left him, and he did odd jobs around the neighborhood. Every day he went out fishing, so there was always something on the table, and between the two of them, Emmett and his mother paid the rent and scraped along somehow. But it was always hard going, and this year was harder than ever. The crops hadn't been good. The sawmill down the river had been slow, and many animals were out of work. Housewives who used to give the wash to Mrs. Otter were doing it themselves. Grown animals like Jake Beaver and Grover Muskrat, who'd been laid off at the mill, were doing most of the odd jobs that Emmett used to do. We'll get by somehow, Emmett and his mother used to say to each other. We always have, but they were tired of just getting by. Last year, I gave Emmett a muffler that I'd knitted, Mrs. Otter said to Irma Kuhn. And the year before that, it was mittens. Nothing wrong with mufflers and mittens, Alice, said Irma Kuhn. It's the thought that counts. I know all about that, said Mrs. Otter, but it's been such a rock bottom life for so long. Just once at least, I'd like to bust out with a real glorious Christmas for Emmett. Something shiny and expensive. It's a bad year for that, said Irma Kuhn. It's always a bad year, said Alice Otter, and she went on with her washing. Ma's never had it easy, Emmett said to Charlie Beaver. We never had much, even when Pa was alive. What with him being a traveling man, always up and down the river selling snake oil, he'd be gone for weeks on end sometimes, and when he did show up, he never brought much money with him. Ma never complained, though. She said if Pa was willing to take a chance on snake oil, she was willing to take a chance on him. I wish I could fix it so she didn't have to do any more washing. And if I can't do
Mary,
that,
your time is up if you could
at
finish
least
up.
I'd like to give her one real good Christmas, to be continued, perhaps.
Thank you. Next, I have Bob Wiley from Emmett County.
A few moments ago, I heard from another retired physician. I'm a retired physician, and I gave him a copy of what I'm going to say because I think my views are significantly different, which makes your jobs as commissioners on the health board very difficult, because I think there's some decisions that you've made in the past and then make in the future that require good information. And how do you get that good information? Well, we can talk about that. The title of this, and I'll probably do half of it now and half of it at the end of public speaking at the end of the meeting here. The title of this little presentation, the COVID vaccine is a killer. Our CDC and our government have been untruthful. You can feel it. We are in a world war. Every nation has been attacked by the COVID-19 virus. Every nation is now dealing with the deadly consequences of the COVID vaccine. So you know me pretty well and know that I've suffered one of the consequences. As a part of the world war, the peoples of the world are also dealing with some major moral and political issues. Which is better, capitalism or socialism? Do the ends really justify the means? Should your family demand your loyalty, or does the government demand your loyalty? Which one wins? Many are hoping that one world government will be the answer, and it may come to pass that honor your father and mother and the freedom to worship may be abandoned through such government. Will the state government actually replace religion? What is going to be our future? It's difficult to tell. We, the people, are feeling more and more like pawns controlled by censorship and suppression, orchestrated by very big money Big Pharma, mainstream media, military industrial complex, and the socialist communist movement. We have lost confidence in our government, and it's, is it really working on our behalf? Is our government working to control our borders? Not likely. Is our government working to ensure fair elections? In many people's eyes, no. In our government working to ensure medical care delivery system is working on our behalf and not for the benefit of Big Pharma? Many feel they're working for the benefit of Big Pharma. One more sentence here. Corruption is up and everywhere you look, even in medical journals and hospitals and in many of our own doctors' offices. I'll be back at the end of the evening or end of the meeting.
Okay. That is all the names that I have, but if anyone else would like to address the Board of Health, this is your opportunity to do so. Yes, sir.
Hello, Scott Koger, Antrim County. In light of our first speaker today, it wasn't entirely wrong, but we cannot focus just on homosexuals. There's been recent, well, in your packet, I believe, is an even better report saying other STIs are on the rise, but here's one off of 9 and 10 News. HIV cases in northern Michigan have risen 214% since 2019, which has led local health department and local clinics to try to raise awareness and stop the spread. Antrim, Benzie, Charlevoix, Emmett, Grand Traverse, Kalkaska, Leelanau, Manistee, Misaki, and Wexford counties saw a total of 44 new diagnoses from 2019 to 2023, compared to just 14 from 2014 to 2018. Melissa Hahn, Director of Family Health for the Health Department of Northwest Michigan, said, "We're still in an area that doesn't see a super large amount of HIV, but there's enough that it's making us take notice that something is wrong." Typically, HIV is less common in rural areas, usually showing up in cities, with many of those diagnosed under the age of 30 and part of the LGBTQ community. However, the Thomas Judd Care Center in Traverse City said over the past 4 years, they've actually seen more heterosexual couples than anything. I love facts. Our cases tend to almost be exclusively 30 and above, and most of them being 40 and above. They're generally white, and they're both male and female, so it's not the typical groups, explained Sean Kindig, a clinical nurse practitioner at the clinic. Kindig said they've even been administering HIV tests to the homeless every week, but haven't had anyone come back positive. Neither the clinic nor the health department know exactly why there's been such a rise. They guessed a lack of education, I'd agree, and more people in the area may be playing a role. As a teenager, it's not being as talked about as much in school every day like it was when the AIDS epidemic first started. So I think people just aren't thinking about it nearly as much as there have been previously, Han said. Many of the people who have recently tested positive over the past 4 years didn't get tested until they were stage 3, which can be deadly. And didn't explain part of the reason for that is because people simply didn't know. People who have contracted HIV will have flu-like symptoms, including a fever and maybe a rash, but after a week or two, those symptoms could fade and not reemerge for another 5 to 10 years. Both the Thomas Judd Care Center in Traverse City and the Health Department in Northwest Michigan say no matter who you are, you guys can read the rest yourselves. Thank you.
Thank you. Would anyone else like to address the Board of Health? If not, we will close public comment. And the next on our agenda is our health officer report by Mr. Dan.
Thank you. Good morning.
Morning.
So my report, I wanted to give an update on the statewide sanitary code update, mainly, just because there's been some activities surrounding that recently in the second part of November. Actually on November 16th and then again on November 30th, I was down in Lansing, meeting with the stakeholders group, meeting with the bill sponsors. Representative Phil Skaggs, he was at the first meeting, and then at the November 30th meeting, Representative Skaggs and Senator Sam Singh were at the November 30th meeting, as well as several stakeholders. So, you know, and I viewed this as a good thing, that we're being invited to the table, because the last time this came around, we weren't invited to the table. It was just basically we were watching this happen and unfold from afar, and it didn't, you know, trying to, you know, basically send things to them and make them understand certain issues. But, you know, there was no acknowledgement of even receiving that information. So this, I'm viewing this as a very good thing, that we're being included. And there's also a number of other, stakeholders that are being included too, including the Michigan Association of Counties, Michigan Township Association, Michigan Municipal League. And then there's environmental groups, Michigan Water Environment Association for Love of Water, Michigan Environmental Council, also Michigan League of Conservation Voters, and the realtors are there, as well as Tip of the Mitt Watershed Council. And then that was at the November 6th meeting. And then at this last meeting, on November 30th, they actually had, the lobbyists for, the Michigan Septic Tank Association was there, as well as a few, septic haulers and inspectors that do this work, private inspectors, not anybody working for the health department. So that was really good that they were there to give their input, because they had a lot of input, you know, regarding this. You know, at the November 16th meeting, and this was all organized by the Southeast Michigan Council of Governments to try to, you know, convene. So I'll give them a lot of credit. I mean, they really kind of pushed the legislators to pull this group together. Just because, you know, they're keeping an eye on what's going on. And there's, you know, has been a lot of opposition to these bills as written, as I think a lot of you know. And, you know, basically there's some issues, well, I'll get into that in a minute, but, so there was some presentations done, from each of these kind of groups, I guess, and we were one of them. Local health departments were one of them, you know, and a lot had to do with, you know, reporting and data management, site permitting, installation criteria, inspection and maintenance frequency, training, certification, fees and funding, and just, you know, all of those things that kind of are wrapped up into these bills. Basically what we focused on from the local public health side is what the numbers are looking like, right? Because once we kind of dug into the numbers, and I will qualify this with, this is a very rough estimate, because we don't know the numbers. That's part of the problem, is we don't have like a statewide inventory of septic systems. In fact, I would, you know, just based on some, you know, preliminary work that has been done even in our own area, we believe that anywhere between 40 and 50% of sites out there with septic systems, we've never even set foot on. We've never even issued a permit. We've never been there. So there is estimated 1.4 million on-site systems in the state, and that is a 2010 number. I mean, this number has been reported for years, and obviously since 2010, we've added a lot more of those systems. So you can see how these numbers are not exactly right, but this is what we got. This is what's being, you know, stated out there. And so if, you know, our biggest concern is this requirement for frequency of every 5 years inspection. And I'll also qualify this by saying that, you know, in local public health departments, there's no better advocate for public health or the environment than health departments. And we certainly recognize the benefit of having a statewide code that would raise the bar, have minimum standards for all. In Northwest Michigan, we have robust standards that we follow. We have since the early 70s. And I've stated this before, other parts of the state do not. I mean, There are parts of the state that it can actually put a septic system in groundwater, if you can imagine that. So there is no minimum standard. There hasn't been ever, right? It's all based on what individual counties or health departments have as their sanitary code. And that's what a health department is measured against. It's whatever that governing entity, develops as a sanitary code. Here, we've been very progressive in that arena because we value our natural resources and we have a lot of sand. So we're blessed with that. Other parts of the state, they don't, their geology is completely different. And a lot of this, a lot of economics ties into this, right? To be able to build a mounted system in some areas of the state, like St. Clair County, for instance, they would have to truck sand in from, 100 miles away or more, right? So you can imagine the expense. So anyways, I guess what I wanted to say is that, we're not opposed to a statewide sanitary code, but just something that works, right? And that can be implemented. So just getting back to the numbers a little bit, this every 5-year evaluation, we estimated, 280,000 evaluations per year, 5,385 systems per week. This is statewide. We would need, this is based on if realistically based on the criteria that's in the bills as written, it's very comprehensive, right? You have to dig up the septic tank, pull the lid off, dig a couple holes into the field. I mean, these inspections are not going to be easy by any means. And you can imagine like some of them could take a long time. And on average, we picked a very conservative number of like 3 per week per inspector, and then you also have the paperwork and everything that goes on with that. That might be a little too conservative. Maybe it's better than that. Maybe it's 4 to 5, but we just don't really know. Right. But based on 3 per week per inspector, we would need about 1,800 qualified and registered inspectors statewide. That is a huge point of concern because of the workforce issue. Like, we have health departments saying that they have postings out for sanitarians for weeks, months without any qualified applicants. So, you can see where that would be a huge issue. 30 to 50% of the public health workforce will leave over the next 10 years. So, we have our work cut out for us just maintaining what we have right now. Funding estimates, what would that cost for those evaluations? Basically I broke it down into the report a little bit, just again, on some very rough assumptions about what individual costs would be. But if you were doing an evaluation and pumping the tank, it would be 287 million per year that would have to be paid out by individuals, property owners. And then if you look at, how many failures and we're just taking like an average failure rate based on the failure definition in the bills as written, is 25, we figured 25% of those systems that are being evaluated would actually be in a state of failure and would have to be replaced. And so then we're talking about 560 million per year for conventional systems, and I'll just point out that I missed 3 zeros on the 700. It says 700,000. That's actually 700 million. I realized that today. So yeah, 700 million per year for alternative treatment systems with an average price tag of $50,000 for those. Again, are these numbers completely accurate? Of course not, but we're just kind of taking a conservative look at it. So what does that really mean? 1.226 billion. I actually screwed that number up too. Sorry about that. I wrote 1.25. It should be 1.26. 1.26 billion per year. And then over 5 years, $6.260 billion to, if, this is the numbers we're talking about. Even if, let's say we're way off on these numbers and you reduce that by half. We're still talking billions of dollars, right? So right now the state has an appropriation of 35 million for a septic system replacement loan program. And, that is going to fall far short, if these bills are passed as written. I don't know you're all familiar with, there was 5 million allocated for water testing. That we reported on, I believe, to this board, maybe 6 months ago. When that went into effect, that actually lasted for like 10 days and it was gone, so this, we just, feel like that amount of funding, if this passes as written, that is just going to really fall short. Some additional considerations, conflict of interest if using private inspectors. I mean, I think it can be done. And I think there's really no way health departments could take on an inspection program by themselves. But it is a concern and that would need to be addressed. That would be something that, would have to be looked at and done correctly. Cooperation of local prosecutors and law enforcement, given the likelihood of increased noncompliance with the law, right? Because we all know that there's going to be a number of people, if this passed as written, are going to not, allow inspections on their property. So addition of more health department staff, whether it's, for if we're doing the evaluations or overseeing private inspectors, because we would have to oversee them. We would still have to add staff for that reason, and also keeping in mind the increased need for additional permits because of failures, right? We'd have a substantial increase in FOIA requests. And then another big, huge thing is wastewater treatment plants and septage, pumping, hauling, disposal capacity, right? And this is something that we heard from the Michigan Septic Tank Association and the haulers that were at the table, is that there is not the capacity. If this passed as written, like it would blow up the system, because the capacity is not there to handle this amount of waste volume. There's already problems with capacity already right now as is. So, we were talking about recommendations, moving forward. I think this, it's, like I said, we're not against a statewide code, but, we want to take advantage of this opportunity. But we need something that's balanced and considers the cost benefit ratio, something that makes sense, that improves public health and reduces environmental impacts. To use our, MELF and Maliha core principles as guidance, and those core principles, I've shared that with this board before, and I'd be happy to send those out to you if you request them. But basically, for inspections, for instance, it talks about using, instead of frequency, using triggers as inspection, like a time of sale, time of transfer. There's usually money on the table at that time. It's much more palatable. It's expected that inspections are going to occur. But also, building permits, if you're going to put a big addition on your house and the septic system needs to be, I mean, that's already happening, right? We're already looking at the septic system at that point. If it's complaint driven, where, there's a property that has a failing system, why is it failing? There should be an inspection there. And then, one of the big things with the trigger type inspection that is being captured is places that never transfer, like that are in trusts. Or like I said, 40 in Milton Township, for instance, I think it was 43% of the properties that are in Milton Township we've never been to, right? So to me, that is the low hanging fruit as far as evaluations, and in Torch Lake Township built that into their ordinance. And perhaps that's a better way to look at this, instead of requiring something every 5 years for everybody, where, you could have a house in a subdivision on top of a sandy hill that just doesn't need it, right? Why would we require something that isn't needed, right? So that's taking more of a risk-based approach instead of just a broad, swipe with the hatchet. So I like that, being more thoughtful about that. And that is some of the advice and comments that, we're bringing to the table at these stakeholder groups. And, I will say that it does seem like the bill sponsors are are receptive to this information and really kind of stepping back and thinking about it more, because the bills as written are really just regurgitating the ones that failed in 2018. And there was, like I said, the problem still exists. So, one of the things that we talked about is maybe phasing something in where you do a statewide database first, where you actually get an inventory of all the systems in the state to, really know what you're dealing with, right? And part of that could be, funding to health departments to digitize their records, maybe would be a good idea. And then we could, we would have those records to be able to put into this database and make some progress in that area, and then maybe phase certain things in, some of the other things in. But I think raising the minimum standards across the board statewide would go a long way to address some of the problems that are being, talked about as far as impacts to the surface water and public health. It's kind of an interesting, I'm sure most of you are aware, but in the House, there was 2 members of the House that were elected mayor in their area. I can't remember what towns, Warren maybe, and another one, I can't remember exactly which one. So basically there's not much going on in the House right now. So I think this, and the governor is calling for a special election to replace those seats. So what we're hearing is from our sources, lobbyists basically, is that they don't believe much is going to happen in the House until May, right? After these new people are seated. So Senator Singh is kind of taking over and championing this effort for statewide code. And Senator Singh, I talked to him when we were at this meeting, and he understands, he especially understood about the capacity for septic haulers. That issue really seemed to resonate with him. And so I'm cautiously optimistic that they are listening to the concerns that we have, and really, maybe putting some thought in it. And hopefully we can maybe get them to change some of the aspects of this statewide code as written. So any questions about that?
I do.
Okay.
I know I talked to you about this before. For the pumping septic companies, did they talk about the disposal centers? Because we don't really have one in our.
Yeah, there was some talk about that, and there is not many disposal centers across the state. I mean, there really isn't. And each of those have a certain capacity, right? They can only take so much. It's not unlimited, right? So the good example is Grand Traverse County. They are, and I heard from the environmental health director at Grand Traverse County that, their DPW director, John DeVozo, basically said that, we're pretty close to capacity as it is. So like this would really, it's not something they could take on without expanding the plant.
But did they talk about any funding to create them?
No.
No,
No,
nothing.
there's
No
nothing
solution.
there's nothing attached to the bill that would do that. Now, that is something that should be done,
Mhm.
right? So there's all these pieces, right? These infrastructure pieces that are missing. That is, what is being pointed out, really.
Yeah, I would stress that.
Yeah, definitely.
Mr. Mason, you had a question.
Yes. Dan, I can appreciate where you're coming from, with your side of the issue, and this is huge. It's bigger than even this. I mean,
Mhm.
do you recall Otsego County had, before we had Eagle, DEQ, standard issue was what a septic hauler would do was he would spray it out, dumping it into the field. After a week or 2 weeks, he'd have to plow that under, and after a certain amount of time, they would seed that field. And allow the bacteria to work in the field to break it down. The biggest issue they had was needles.
Mhm.
And then they would alternate with other fields. Now, had you ever heard, Siegel County had two, there must have been other places. It was far easier to obviously handle large quantities when they had control of the situation like this. Have you ever heard that Otsego County had any contamination? This went on for 30 years or 40 years, maybe longer than that.
No,
Probably before my lifetime. You never heard
no,
they had
and
contamination with the old system.
no, and you can still land apply. It's just they changed the requirements, the state law. So they tightened the state law. So instead of, yeah, I think it was 48 hours, they had to till the field after they dumped, or it might not, it might have even been longer than that, but now it's 6 hours, right? So it makes it very difficult for a hauler to
Correct.
land apply and then incorporate into the field
Correct.
within 6 hours. They can get away with that by having an injection truck. Then they don't have to incorporate, but so there is still opportunities to land apply. One of the problems that we are starting to see in northern Michigan, and they actually, as maybe like a little foreshadowing microcosm of what would happen everywhere else in Grand Traverse County, people, there was less and less land available because of growth, subdivision here out in the country or whatever. And then you have these isolation issues, and you didn't have landowners that wanted septic haulers, on their property anymore for whatever reason. So, I mean, the land application, even though it is, and it's a vital part right now, but as, you see growth and expansion out into these more rural areas, and just having landowners and farmers that will allow them on their fields, because there's other things like gap requirements for farms. And I think you could probably speak to that, Jairus, but which makes it a lot harder, right, to use that type of waste for fertilizer.
Right.
So, right.
So historically, we've not had these issues. And we have to go back a lot of years. That Europe had its greatest problems probably before they understood the bacterial breakdown, this type of thing that's gone on for many years in this country. And I know you've spoken to the high standards of Northwest Michigan. And I think everyone's kind of catching those standards. And I think this threshold that you talk about this kind of standard here is huge beyond what is practical and necessary. And it reminds me, because Eagle is involved in this. And when Eagle was involved, when it was created under Governor Engler, I think it was 1988, he gave them the authority to control everything, including the removal of all gas tanks. Eventually, they had to, there was, I believe it was called the Mustaf funding. Do you recall that? And that
Yes.
had to do with commercial, removal. We were a small excavator. We did not have, the insurance policy was so huge. I think it was like a $75,000 or $80,000 payout to be able to have that insurance policy. And when hundreds, if not more than that, maybe thousands of excavators could no longer remove fuel tanks, it was left up to the very wealthy. The Mustaf fund was supposed to last 10 or 15 years before being refunded. I think within 3 years it was broke.
Yeah.
So this is the problem. We're getting the state, they're coming in, and if I'm not mistaken, when this was talked about in June, there was even talk about them being able to come into your home to inspect the house. And you remember us talking about that?
Right. Well, and as written right now, that's some of the things that's in the bill right now as written, that you have to verify that the plumbing is connected to the septic system. And I don't know any other way to do that other than going into somebody's home and looking in their basement. And that is a huge problem for us too, because we don't want to go into people's homes. And I don't, it's not something that, is something that's going to work.
Yeah, I mean, it just borderlines I mean, it's constitutional, for one thing, it violates that. And then secondly, I think we have to think where we're heading right now. It too closely resembles what took place in Germany, what, for 5 years and during the period of World War II. For 5 years prior to the war and then that period of the war. I mean, Europe went over the edge, or at least Germany did, perhaps Italy with it. So I think we need to really reflect on where this all builds, it's creeping into something that, and I can appreciate where you're coming from. The other thing I've noticed was that a lot of the people that they invited to be present have vested interests with, you talk about conflict of interest, and that's mentioned, reporting of data management, all rely heavily on local government, health departments, the fees and the funding. It's just the fees and the funding. You're right. I mean, you've given a conservative estimate of 3 a week. They could probably, an inspector could probably handle 5 or 6. But I mean, we're talking huge money out of the taxpayers' pockets. That, where does it end?
Right, and some of those, and I forgot to mention this, but, you know, what is being pointed out is like, we're the last state in the country that doesn't have a statewide code, and like all the other states around the Great Lakes have a inspection, they have a statewide code, plus they have an inspection, requirement. That's a frequency based, anywhere from 3 to 10 years, but most of them are like around 5. But here's the thing that I pointed out at the meeting, because I looked into that, and what these other states do for their inspection, like basically they have someone drive up, walk over the drain field, and if there's nothing ponded there, then they move on and they do like 20 a day, right? So, yeah, so it's not apples to apples, right? So in the bills as written with this comprehensive, you know, very detailed inspection, you simply can't do that, right? On that frequency. So it's all, you know, the devil's in the details with this. It's a very complex issue. And you have to understand, you know, all the different things, because, you know, with this being passed, if it passed, I mean, it would be huge, right? It would be something that I don't think could be implemented, you know, from the local health department standpoint.
Mr. Chamberlain? Yeah, Dan. So I kind of broke down your numbers more to like a day-to-day process to the whole state. So we're almost at like 1,100 a day. So between 83 counties, which it wouldn't be, you're looking at 13 a day. So our 4 districts, or our 4 counties, you know, you're at 48 to about 16, over 16 workers. And I've had to find a septic, or not septic, but a drain field once off a drawing from the health department. The excavator, you know, he threw it out on there and we had to go find it. Took us almost a whole day. So it turns out what happens over 20 years, trees grow, and it was next to popples. Those popples grew out. It was all the way in the woods, but in that 20 years, it was crazy.
Yeah.
It took forever to find. So that's the trouble you're going to find, I think, some of these inspectors.
Right.
So
Good points.
be interesting.
Just out of curiosity, is this legislation geared toward moving all municipals toward collection facilities? Or because there's more than one, you know, most of the haulers in Emmett County, I believe, don't go to the sewage treatment plants to dispose of their material.
Right. And most sewage treatment plants don't have an option for septage, because septage is a high strength waste. It's not, you know, your everyday sewage is, you know, much lower strength than accumulation that is pumped out of a tank, you know, that may have, you know, and at least initially too, you know, if something like this happens, you know, if someone hadn't pumped their tank in 15 years or something, I mean, you're talking really high strength waste. So it's got to be pre-treated. You have to have a receiving facility pre-treated typically before it then goes and gets polished at through the normal process at a wastewater treatment plant. So it's not just simply having a, it's not simply gallons, it's also the strength of the waste.
And one more question, are ejection wells, are they few and far between, or is there more of them than you might think?
That
haulers
I,
use?
I honestly don't know. I think the state or Eagle regulates injection wells, and I have no idea like on how many of those we have in the state and what they even accept.
Yeah, I can tell you from personal experience that most of them now, they do injection because of the time requirement, because if you have a chisel plow or a disc that breaks, how are you gonna get that in it covered within 6 hours? So most of them are injected. There is some concern in the agricultural community about what's in the septic, because sometimes people don't think about what they throw in the toilet. And that goes in the septic system, and then the septic tank empties the septic system, and that's in there. And if we don't have a reading on what that is, I mean, we talk about PFAS and forever chemicals, and we're putting that on our fields. That's going to be there for years, and it can be taken up by the crops, and then the cows eat the crops, and then we drink the milk and we eat the meat, and we have a problem. So,
Well, and that's a really good point, Jairus. And I think that's part of the reason why, a lot of farmers are kind of getting away from, allowing land application, because PFAS, it's been in household products for 50 years or more. It's in septic tanks, no doubt, right? Hopefully not in huge quantities, but the thing is they're measuring PFAS contamination in parts per trillion, which is really small. I mean, some of the standards are, I think for PFOS is 8 parts per trillion. I mean, that is is the threshold, right? So you don't need much to, basically say something is contaminated or not acceptable. It's a very, very small amount. So yeah, I mean, it's a concern.
That's not to mention all the pharmaceuticals.
That's
You
another good
can't filter
point.
out the pharmaceuticals from
Right.
septic.
Right.
I mean, that gets taken up just like Commissioner Rumbaugh said.
Yeah, and people that are going through cancer treatments, chemotherapy. I mean, that's a concern as well.
Mhm.
I don't see any further discussion. You want to carry on?
Yes, thank you. So just some quick updates, HDNW updates. So we have our all staff gathering Thursday, December 14th. And invitations for lunch were shared with you, and we would just request that you give us an RSVP to let us know if you're coming, just so we can make sure we have the food prepared correctly as far as numbers go. And then we also have as part of this what we're doing is another Stuff the Bus event. We did Toys for Tots last year. Our meeting is a little bit later this year, so we couldn't do that because they want, the Toys for Tots they have a lot of stuff to wrap and everything. So the timing just didn't work out. But so what we're doing instead is non-perishable foods. So all the employees are going to bring that to the meeting, and then we also have drop off. All of our offices are drop off locations. So would just, encourage you to participate in that too. And if you can't attend for lunch that day, just, drop some stuff off at our office. We're going to make sure that local food pantries get everything that's donated. So really important this time of year. So so Deputy Health Officer Holly Campbell, sitting to my left here, was recently featured talking about the difference between public health and private healthcare on 9 and 10 News, The 4. The link is in our socials. If you missed it, she did a great job kind of explaining that. And then let's see, on Wednesday, December 13th, our nurse practitioner in Gaylord, Carrie Miller, talks about the Gaylord Blue Devil Wellness Center, which also serves students from Johannesburg. So, so looking forward to that. That the Blue Devil Wellness Center is an extremely busy clinic. There is a severe lack of providers in that area. So we're really filling a gap there, and Carrie is a great nurse practitioner. So I think it'll be very informative. So that's all I have.
The next report that we have in our packet is Medical Director, Dr. Meyerson. Any questions on that for him? I would just say, Dr. Meyerson, I got a phone call from a gentleman this morning about kind of a couple of the comments in public comment about HIV, and he mentioned to me that when he was young, his grandparents would talk about purity and saving themselves for each other until after they were married. And he saw a lot in the report about testing and condoms, but he didn't see anything in there about encouraging people in that way. So I just wondered if you had any thoughts about that. I mean, when I was younger, they commonly talked about abstinence as part of that, as part of our approach to that.
Jairus, certainly that's something we talk about, especially, when we're having, one-on-one counseling with individuals, whether it's, in lots of different programs, we talk about ways they can reduce their risk and, certainly, limiting your partners or abstinence is one thing they can do to do that. And so it is something we talk about with individuals, and it's something, providers are going to talk about with their clients all the time, but it's important to do so in a non-judgmental fashion because, there's lots of different people out there who, live their life in lots of different ways. And it's not our job to judge people. It's our job to meet people where they're at and let them know what the risks are and the many different things they can do to reduce their risk.
Mr. Turnbull?
Yes, Dr. Myerson. I was going to ask, in reading the HIV article, do you guys have numbers for, I mean, is there a way to differentiate between individuals that contract it via their, I hate to use the word promiscuity, but sex as opposed to like unsafe needle use or unsafe, they contract it in other ways?
There certainly is data on that, for sure. But as far as our local area, unfortunately, in the case reports that we had, in almost half the cases, they did not identify risk factors. Sometimes that's simply because they weren't able to get that information. I don't know exactly what the reasons were, but we don't have that specific information related to the report that you're referencing.
Okay. Because one thing I just like to encourage, encourage y'all, encourage the board. Something we spoke about a few meetings ago was the Safe Needle initiative that Health Department is doing. And one of the things that was mentioned was, handing out these needles was to prevent further spread of things such as HIV or those, any other viruses, hepatitis that can come along with improper needle usage. If this is one of those metrics, then, an increase by, what'd you say, 200%. If some of it is coming from improper needle use, then maybe we could look at something else, another way of, fixing that problem rather than, pouring money into the free needle distribution. So it's just something, just food for thought. If that's a metric.
Yeah,
then-
you're correct. And that certainly is a concern with people who inject drugs if they are not using sterile needles.
Mhm.
We have seen outbreaks of HIV related to that in other rural areas, such as in Indiana. And that's certainly something that is a concern here and could be a contributing factor.
Okay, thank you. That's all I had, Mr. Chair.
Anything else for Dr. Meyerson? Seeing none? The next report is Community Health, Kathleen, does anyone have any questions for her? She's not here today?
She's not. She's,
Because I work very closely with her on these programs. If there are questions, I would do my best.
I don't see anything for Melissa
Better.
on family health. The next one is environmental health. Jeremy, on radon, any questions on that? I do have one curiosity question. It seems like the only county that shows a really high incidence of radon in our jurisdiction is Otsego. And just wondering, do we have any hypothesis of why we have a rate there? It says 25% or more homes tested are equal to or above the guideline.
I would probably say just a lot of times with radon, it's geology. The geology could just be a little different where radon escapes a little easier in that area. And it's more specific in the Elmira zip code. And that's where we see the levels above 4 on average. So that's probably like I said, maybe that region just has like the geology promotes more radon in that area escaping.
So then my question is, if we're seeing this in the Elmira area,
Mhm.
are we encouraging people with an Elmira zip code to get their house tested? Because I mean, looking at the data, it looks like someone with a farmhouse there would be a lot more likely to have a high rate than someone like me who has a house in Ellsworth. You know what I mean?
Right. Yeah, I mean, we could definitely increase that awareness in that area. I know that, I mean, this is specifically for, my report was to let you guys know that we are gonna be doing radon awareness in January, but it's a good point. I mean, if we have a higher level in a certain zip code, maybe we could address that, even through social media or things like that. So, no, it's valid.
Okay.
So,
That's my district, so I'll make sure I tell them when I have a meeting this week.
okay.
I'll tell them to call you, Jeremy.
All right.
All right. Next we have the Personnel and Finance Committee with the November bills.
Yep. I'll make a motion. The Finance Committee meet to review the bills and employee expenses and would like to make a motion for the full board to approve the November 2023 bills in the amount of $940,038.62 and the November 2023 employee expenses of $24,934.99.
Second.
Okay. Any discussion or question on the bills? I did have a question on page 1 about halfway down. The Benzie Leelanau District Health Department for $25,378 contract payment. And it looks like the same thing a little further down for the Central Michigan Health Department of $21,958.
Yep, these are contracts. So a lot of we end up being the fiduciary for a number of programs in our region. So we contract with other health departments to do some of the work. And then we pull the money down from the state and distribute out to all of those who have done the work based on the invoices that we get back. So that's what those are both for. You've got Benzie Leelanau and Central. I lost it now. It's in here.
Central Michigan. Yep.
Central. Yep.
yeah, I think that was specifically for Healthy Families America.
Yep,
That program,
is.
which is a public health nursing program where they do home visits.
Okay. And then on the second page, two, four, six, 7 down, there's a gentleman by the name of Don who says for $105 for staff reimbursement.
Yep.
It seems like that should be in employee expenses.
So the employee expenses are for anything related to travel. So if you have a meal, mileage reimbursement, a hotel, something like that, if you need to purchase supplies of some sort, in this case, Don is one of our environmental health employees. If he needed to purchase something for his job, then it goes through our expenses this way. Our employee expense system only covers travel expenses. Does that make sense?
Yeah, I've just seen miscellaneous in employee expenses before too. Maybe there's some in here now. So I just didn't know how
Yeah, we don't typically put supplies and things like that into our employee expenses. We keep those on this side.
okay.
So it's just how we maintain our systems.
And then 2 pages more, Reman Robson, $35,586, 2020 employee retention credit.
Yep, this is Raymond. Dental Clinics North qualified for an employee retention credit, and there's a lot of paperwork that's involved with it. And so this is the bill for that paperwork. And it is high, but we expect to get back a lot more than the bill. So we felt that it was worth the effort to go ahead and do this. Hold on, let me pull my paperwork here. We expect the credit will be $475,000. So it was worth filing.
And this is still from 2020?
Correct. Their staff were not working during that time. This is a federal employee retention credit.
And we're just getting it now in 2023.
Yep. In fact, if you own a business, you're probably getting phone calls from a number of scam artists that are saying, we'll file it for you for a fee. I highly recommend you don't do that.
That's all my questions. Does anyone else have any questions? If not, this is spending money, so we'll have a roll call vote.
Commissioner Aaron's,
Yes.
Commissioner Rubink,
Yes.
Commissioner Mason,
Yes.
Commissioner Levanway,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Mapes.
Yes.
Motion carries.
Thank you. It looks like we have no unfinished or new business at this time. Is that correct?
Correct.
We do have a closed session. I'm wondering, in the past, this board has allowed public comment before the closed session so that if people desire to address the board, they do not have to wait while we're in closed session for a half hour. Is there objection to switching those? Seeing none, I'm going to move public comment before we go into closed session. So at
That's good.
this time, anyone who would like to address the board has 3 minutes.
Bob Wiley again. And I'll pick up where I left off. The whole COVID and vaccine environment was surrounded by very big money, as I mentioned earlier. And because of billions and billions of dollars that were thrown at this project, it affected many areas of our society. The entire medical delivery system has been infiltrated and corrupted by the money. I mentioned earlier that even reliable and respectable medical journals were some of the best in the world were corrupted and proven to be corrupted by the way they suppressed certain literature that should have been published and where they published literature that was completely non-factual. For the benefit of the things I mentioned earlier, big pharma, mainstream media, the military industrial complex, and political incentives from different political parties. It's because of suppression that is now easing up a little bit. It's becoming more and more clear every day that the shutdowns, the masks, and the vaccine did more harm than good. It's hard to hear that. In fact, in the medical world, when you on one side, which I was at one time, I would take offense at that, but not, it's hard to admit that maybe the efforts that we tried in good faith to do, such as shutdowns, masks, and the vaccine, may have done more harm than good. But I encourage all of you to do your own research. To start, you might consider a few hours, not just 1 or 2, but maybe 10 or 20, in viewing some of the proponents of the side that maybe you haven't heard. And some of these doctors you may have heard of, and if you haven't, I encourage you to read some of their publications and videos. Dr. Robert Malone, Dr. Peter McCullough, Dr. Huff, Dr. Naomi Wolf, and I have written an email to a friend of mine whose name is Dennis, but I don't list his last name. It's not important. And I wrote it yesterday and discussing some of these issues and discussing in particular a particular whistleblower out of New Zealand. And if you'd like to have a copy of what I have, just talk to me. The commissioners, I'll try to send it all to you in an email so that the links will be easy to follow. Thank you.
Thank you. Would anyone else like to address the board? Yes, sir.
I'll keep it very brief. Thank you again for allowing public comment. I very much enjoyed sitting in on this meeting. It's lovely to see that you all do very much care for the people here. Now, I simply wanted to address a couple things that were said earlier on, specifically from Dr. Mayerson. I hope I'm saying his name correctly. Mentioned that nearly 50% were not identified. Now, if I understand correctly, the statistic he's citing, it was brought up in the letter that was put out for the people as 41% not having the, not being from an identified risk factor. That would mean about 60% are identified risk factors as coming from sexual promiscuity or from needles. And that would mean the other 40%, it's not that they're not coming from that, it's that they weren't identified. This does mean, again, I reassert, that sin is at the heart of this issue. Now, if you were to put out something like this, encouraging only staying away from, or rather only testing, well, that is all well and good, but I would once more encourage the board to put out a recommendation and encouragement to abstinence, because it is abstinence, and I'm speaking here in a broad sense. It is abstinence that would put an end to this problem as a whole. And I may add from the other gentleman that is, I guess, not here anymore. I very much appreciated his. Oh, hi. Sorry. I very much appreciated your comments. I would expand what I said. I do believe homosexuality and the actions of homosexuality are the main reason, but absolutely we should be pushing abstinence in a broader situation as well, because it's not merely that two men have sex and then HIV happens. But there are, but there are people that have these illnesses, and homosexuality seems to be a major driving factor, and simple education and getting them to get tested is not going to be enough. Thank you.
Thank you. Would anyone else like to address the board? Yes, sir.
Hello, Scott Koger again, Antrim County. Oh, and I lost my train of thought. Good discussions today, a lot of good points. To the sewage one, boy, that's a big topic. One thing, and Commissioner Neal brought it up, the pharmaceuticals. A lot of people don't know that. And I'll back that into our smartphones every day, guys. And social media and the internet are both the greatest thing ever and the worst. And it depends on you, the user. I love it. There's so much knowledge out there, but be careful. You can find your truth. It may not be the truth, but be careful what you look into. Stick to the facts. Be like Joe Friday. But back to the pharmaceuticals. It's been pointed out for a couple of years now. It's in the water. It's in the fish. Stuff passes right through your body and passes through waste treatment. It can't be treated. All kinds of pharmaceuticals, not just cancer stuff. Keep that in mind. So, if you look it up, PODS, PODS, I think, locally, we have them in every police department, among others. Dispose of your medications. Don't flush them down the toilet or take them once a year to the state police. Yeah. Make sure you love the homosexuals. Don't just keep beating them up. If you do your due diligence about the health department, you know that they counsel everybody that they treat on various aspects, health, hygiene, yada, yada. So, I'm sure abstinence does get mentioned. That's between, the doctor, the nurse, and the patient. You as commissioners have a really big platform. If you're on social media, make sure you share the facts that health department put out, and you could add your comment if you so choose. Remember abstinence also, and share that with your people. Numbers are great. Maybe we can get some more number crunching locally. But let's not be so quick to circle back to injections, just like homosexuals. Love them. You're a Christian, love thy neighbor, and get the message out to them. Right? I mean, I know that as basics. It's like being a good human and morals. Let's make more awareness. Maybe we could make the needle exchange better. Yeah, I'd like to save money too, but to do nothing is wrong. Let's make needle exchange better. It's spreading between heterosexuals. You guys look it up, but be open-minded, help spread the knowledge. Thank you.
Thank you. Would anyone else like to address the board?
I'm Pat Freilich from Emmett County, and I just really want to thank Dan for the work he's doing on the septic legislation, because that's really important and can have a huge impact on our area. And I really want to thank the whole leadership team at the health department, Josh and Melissa, and Shannon and Holly and everyone and all the staff for all the work that they've done, because it's continuous every day to keep our environment safe, to keep our families safe, and to keep our communities as healthy as they can be. So thank you.
Would anyone else like to address the board? Yes. Yes, ma'am. Anyone else? Seeing none, I'm going to close public comment, and I will take a motion to go into closed session at the health officer's request.
I'll
Yeah.
make a motion.
I'll second.
And it's just the board and you, correct, Dan?
I believe so.
Usually we specify who's going into closed session.
Right. I don't know if, I don't think we'd take minutes from an evaluation. So yeah, I don't think Melanie would need to be in there. And we do have, Melanie did reserve that room over there. So if people are staying, they could stay in here
Okay,
and we could
Yep.
go in there.
that'd be great, because I
yeah.
need to use the restroom before we.
Perfect. Yeah, we need
Yeah,
a break.
definitely a restroom.
Yeah, we'll hold this vote, and then we'll take a little break between now and going into closed session. So all those in favor of going into closed session to discuss the health officer evaluation, please say yes.
Yes.
Opposed, no. Motion carries. Going into closed session for the health officer review. The next item on our agenda is commissioner comment. Mr. Mason, do you have any commissioner comments? Okay. Mr. Turnbull,
No, sir.
Mr. Chamberlain.
I think this is what, our last meeting of the year?
It is.
So I want to thank the whole health department, fellow commissioners. It's been a great first year and just want to say thank you to everyone.
Mr. Chairman,
Yes,
I would like to say Merry Christmas to everyone.
there you go. Mr. Aaron's,
I'm all set.
Mr. Mapes,
Merry Christmas to everyone. Look forward to seeing you next year.
Ms. Levanway.
I just want to say thank you to everybody that I worked with. This really, the people have been wonderful and I had nobody complain to me all year long. And it's been challenging, but we made it. We're done this year. So we only have finance, bill pay, I think in a couple days, but that's all we got left.
I would just like to say Merry Christmas and Happy New Year and see you all next year. With that, I will call the meeting adjourned at 12. I can't read the time. 12:05. Eyes are failing me.
Thank you.